And of course, we've been monitoring the hospitals here in the Dayton area to find out how and when they'll respond to the CDC and Ohio Department of Health recommendations regarding Ebola preparation. Marcia Bonhart asking questions of the Dayton VA and its medical center today. Marcia?
Well, one by one, we are checking with medical centers here. Last week, we told you the 7 hospitals under the Kettering Health Network began preparing employees in case they encounter a patient with Ebola. Well, today, we spoke with an infectious disease expert at the Dayton VA. The Dayton VA reports its Ebola protocol goes beyond what is CDC required. It says it sets tougher standards when it comes to Ebola evaluation and protection.
Diarrhea, nausea, headache, fever of over 100.4, we must and should do a travel history.
In checking anyone presenting those symptoms, Dayton VA hospital officials would also ask if they had traveled to any West African countries or if they had been taking care of Ebola-infected patients.
They would immediately be isolated, and in this case, we have a room in the emergency room where they would be placed. All of our personnel would go into protective gowns and gloves and masks, and they'd be evaluated further. Following that, they would probably be transported to a special room, isolation room, in the intensive care unit.
What is equally important to the VA staff is the proper removal of PPE, or personal protective equipment, after they have cared for an Ebola-infected patient. According to Dr. Bernstein, PPE removal was key with the 2 infected nurses in Dallas.
And it's my assumption, my supposition, that when they took off the stuff, they got it on their hands, and then they touched their eyes, or they touched their nose, or we know it's very hot in those gowns, or they went like this.
This is how the Dayton VA remedies the concern about PPE removal.
One thing that we're going to be doing, and in fact everybody else in Dayton is going to be doing, is when you take off your gown, you have your partner outside the room prompting you, take this off, take that off, wash your hands now, take that off. And if there's any breach in the protocol, the observer will tell them, you've done this, you must clean this area.
It may sound too simple, but good hand washing is the first line of defense against Ebola. As dangerous and easily spread as that virus is, doctors told me today the virus does have a membrane that soap and water can penetrate. Marcia Bonhart, 2 News, working for you.